My name is Dr. Armin Schwarzbach. I'm a medical doctor and a specialist of laboratory medicine. I conduct a practice as founder and manager of a pathology testing provider, ArminLabs, situated in Augsburg, Bavaria, Germany. As well, I practice as a clinical specialist consultant in chronic infectious diseases. Before I established my own diagnostic company, I worked with Infectolab. Both ArminLabs and Infectolab are internationally accredited and respected diagnostic companies in relation to chronic infectious diseases. I have delivered many lectures in Europe, the USA, and Australia on the diagnosis and treatment of tick-associated poly-organ syndrome, which includes Borrelia burgdorferi and other species of Borrelia. I also diagnosed many other microorganisms, viruses, bacteria, parasites, yeast, and mold, which exist as co-infections or other infections in the tick-associated poly-organ disease-affected patients. TAPOS can cause a wide range of symptoms in patients who are infected with these organisms, ranging from no symptoms at all to total prostration with chronic fatigue syndrome, severe psychological illnesses, chronic pain syndrome, Lyme carditis, to multiple sclerosis, motor neuron disease, autoimmune diseases such as Graves' disease of the thyroid gland, Hashimoto's thyroiditis, weakness in regional muscle groups, myasthenia gravis, or Alzheimer's disease. I was named in the 2015 until 2017 Australian Senate Inquiry, along with Dr. Richard Horowitz from USA, one of two international experts trusted by the Australian Department of Health as advisors in the diagnosis and treatment of Lyme-like illnesses. I met Dr. Geoffrey Kemp in Sydney at the conference on Lyme disease held at the Prince Alfred Hospital in 2013. Since that time, he has sought my advice in the diagnosis and treatment of many patients, and also, when necessary, the options of hospital-based care in Germany. Dr. Kemp has treated over 400 patients for the complications of TAPOS, Lyme disease, and many of these patients have provided moving testimonies that, if not for his diagnosis and ongoing care, that many might not have survived their illnesses. His website contains over 80 letters from patients and their relatives testifying to the beneficial effects of the treatment he provided to them successfully. As with many other patients and their doctors attempting to ease the suffering arising from these diseases in Australia, his efforts have met with hostility from medical colleagues and bureaucrats associated with HAPRA and the medical boards and public servants in the health department. They refuse to look at the mounting evidence pointing to the prevalence of these diseases in Australia. The evidence suggests that 5.8% of the population of Australia, in common with other developed nations around the world, such as an estimated 480,000 new cases per year in the USA and over 150,000 in Germany, according to the CDC and German authorities, have been affected by this group of diseases. The estimate is that TAPOS is 20 times more prevalent in Australia than multiple sclerosis and HIV put together. It is a tragic mistake that doctors, such as Dr. Kemp and his medical colleagues, who have also been engaged in the treatment of TAPOS, who have done their patients nothing but good, have been vilified by colleagues and bureaucrats in Australia. Apostrophe. These individuals have refused to acknowledge the life-saving impact of their efforts to address the effects of TAPOS over the last 20 years. Dr. Kemp was attacked by these colleagues and bureaucrats in 2015 on grounds which were so dubious that 2 Senate inquiries were established as a direct result by Senator Madigan. The first was into the presence of a Lyme-like illness in Australia or disease. The second, into the medical complaints process and the bullying of doctors. There were over 1,200 submissions into the Senate inquiry into Lyme-like disease. The inquiry into HAPRA was the second such inquiry. A third was established in May 2021 and is due to report to the Parliament in November 2021. This inquiry has heard from a number of stakeholders that the doctors practicing integrative medicine and those who have attempted to diagnose and treat Lyme disease successfully in Australia have met with undeserved hostility and vilification from the same group of medical colleagues and bureaucrats. This conduct may well come to be recognized as misconduct in public office endangering human life. I can only hope that wisdom and common sense will prevail and that Dr. Kemp will have his medical license restored to him back as soon as possible, please. Thank you for listening. Armin.